One moderating factor was gender. Boys showed more positive attitudes towards violence and showed more externalized behavior, whereas girls were more likely to show internalized behaviors. The external moderating factors included the length of time since exposure to the violence, which showed that more recent exposure led to more social problems among children. And the other external moderating factor was the child's relationship with their mothers and the adult male batterer. However, at the time, the information that did exist was mostly focused on mother-child dyads, while the examination of the father-child relationship was virtually non-existent, which proved to be a weakness to the study. The future research recommendations for Edelson included additional research on the impact of exposure to domestic violence on children, a better understanding of the cumulative violence, media violence, and marital discord, additional research of potential protective factors that highlight children's resilience to inform the development of programs that enhance children's success to reduce negative impacts on domestic violence exposure, needs more research on the child-father relationship. Also, Edelson urged researchers to expand beyond adult reports of children experiences and children in crisis or shelter. The findings on the impact of exposure to domestic violence showed that children who are exposed are at an increased risk for depression, anxiety, and attachment disorders. They are often more likely to demonstrate more behavioral issues, which can include aggression, noncompliance, and delinquency. Also, symptoms related to post-traumatic stress disorder. Also, children who observed domestic violence more than once also showed to be at a greater risk for dissociation than children who only observed one violent event. The cumulative effects of exposure to multiple forms of violence can sometimes be referred to as the double whammy, which includes experiences of both domestic violence and child maltreatment. It is also important to note that men who experience both types of violence perpetrated intimate partner violence more frequently and more severely. For the potential protective factors that highlight children resilience, the literature suggests ways to minimize and treat exposure to domestic violence, but few focus on identifying and fostering resilience. It's important to note that mental health, social support, positive parenting skills, good self-esteem, the ability to regulate emotions, and treatment of trauma symptoms have been found to have a positive impact on children exposed to domestic violence. Also, an important difference between the four groups was that the mothers of children in the resilient group were less likely to have an abusive partner in their past. And child-parent psychotherapy, also known as CPP, has been found to be effective in improving behaviors among children exposed to domestic violence, as well as those who have been exposed to multiple forms of violence. The father-child relationship findings showed that men who were exposed to domestic violence reported their fathers as less accessible and less involved. Also, men who were not exposed to domestic violence also reported their fathers to be more emotionally responsive and engaged in comparison to exposed men. Also, men in the exposed group were significantly more likely to use abusive tactics in their interpersonal relationships than men in the non-exposed group. Lastly, during play, boys who had fewer visits with their father presented their mothers more negatively. Recommendations for further research include data collection that captures the domestic violence experience in children rather than just their negative behaviors. Also, expanding beyond just adults' reports about children's experiences would be beneficial. This would aim to capture children's exposure to domestic violence from a child's perspective and capture the coping strategies or resilience factors that the child uses.